Welcome to my channel again. This is Chris, and there are a few very important things I'd like to discuss today. And these would be vital signs. For my nursing students who are in school, first semester, second semester, you are taught how to take vitals even before that, and they are very important. In the nursing home setting, if the patients or residents are unable to speak for themselves, vital signs are the first thing you look at, which will tell you a story. If there's something wrong with them, something's not right, something's different, by taking vital signs, you already can have an idea of what is going on. You might not have the whole picture, and it is not your responsibility to have that, but you will have all the necessary elements in order to take notes and document and save them for a report, which you will do quickly if the vital signs are off. With that being said, I have noticed that in most of my nursing homes, unless a doctor orders vital signs or blood pressures, especially in heart rate, to be done with blood pressure medications, this is not something nurses need to do. And let me tell you why it's wrong on so many levels. If you don't take blood pressure before giving blood pressure medications, since nursing school taught you what blood medications are, what they do, and how they act on the system. So you have 3 blood pressure medications, you go to your resident, you put them in applesauce, and you tell them, here you go, take this. 30 minutes go by, the patient crashes. You take a blood pressure, 60/40. They're half responsive, very confused. You're going to call the doctor. You're going to call a healthcare provider. Somebody's going to tell you what happened. I don't know. What is the blood pressure? 80/40. Okay, what was it this morning? I don't know. I didn't take it. How do you think that somebody's going to respond to that? Clearly not very well. Now, if I haven't emphasized it enough, your license is the most important thing that you have. You have worked or are working so hard to keep that license active and to continue to work as a healthcare provider because you care. Now, an error like that, should it cause a patient to die or to be intubated because of it, the only person responsible is going to be you. I'm trying to save you from this because good nursing means before giving a blood pressure medication, we take a blood pressure. It only makes sense. I know that we are busy. I know that there's too many residents. There's too much to do, but this is nursing 101. It's really important. When I was in nursing school, I was taught to always put Your Honor, or to think Your Honor, in front of any charting. Why is this important? Because it's not if, but when you end up in a court of law. If your documentation is not accurate, if you didn't do what they call a prudent nurse who has the same education as you would have done, you end up losing your license. Once you lose your license, you may not practice as a nurse anymore. Why get to that when it's so simple? A quick blood pressure. The other thing I would like to say is do not always trust machines. If you trust the machines, you no longer practice doing it manually. It's really important, especially the wrist machines. They're not very accurate. You take your blood pressures manually. If the person has atrial fibrillation or some kind of arrhythmia, you take the heart rate manually for 1 whole minute. Because if the heart rate is normal, you take it for 15, 20 seconds, you multiply it by 3, by 4, and more or less you can estimate, actually not more or less, with precision, what the heart rate is. However, if the heart rate is irregular, you cannot multiply it by anything. In 1 minute, you need to know what the heart rate was by taking it manually. I hope these things have helped you today. And on the next video, we will talk some more. I wish you a wonderful day.